My name is Bonnie Levin. I'm at the University of Miami. I'm in the Department of Neurology. I've been there for about, well, 37 years now. And I've been, you can't hear? Oh. I've been there for about 37 years, and I've had an interest in decision-making and cognition over the lifespan since I started. I began my work with my colleagues here and another team associated with the McKnight Brain Research Institute. We're interested in social decision-making, judgment, in the aging process. So we're going to talk a little bit about the cognition and how one ages over time, and how the aging process alone puts one at risk for poor decision-making, or decision-making that is different from the kinds of decisions that you make when you're young. But I think today we're going to shift the focus away from what happens after one is scammed or exploited and what we can do before. So I think we're all going to sort of focus on what associations with science and literature and our own research on what we've learned about the things that we can put into place so that people can avoid being scammed in the first place. So I guess I don't need to review again that we have now reached a public health crisis with respect to financial exploitation. It's become a virtual epidemic. And I want to call your attention to the last line of this slide, which you probably cannot read, which is that victims more likely to be scammed to be men 70 or older and tended to be risk takers. About half of fraud victims agree that they did not mind taking chances with their money as long as there was a chance it might pay off. So that is something that I'm going to come back to. So, whoops. Wait.
Sorry. So you hold it this way, and it's these two arrows.
Okay. Yeah. I was doing it the other way around.
Should be. Sorry, you might hit this. There's an off button.
Okay.
There you are. And
where's it?
Can,
I'm just going to press the forward button.
Yeah.
Which is that, right? This one or that one?
It's in that one.
Okay.
So that one.
Okay.
Sorry.
So here are some examples of some Florida scams. Actually, the ones that we talked about today aren't even on the list. And the level of sophistication has evolved over time, logarithmically more complex, more embedded, more deceptive. These are just some of the popular scams in Florida. So let's look at some of the Florida statistics, which will help us understand how we got ourselves into this in the first place. It's not that it's not happening everywhere in the United States, because it is, and it's happening at every age. But Florida is, unfortunately, probably the scam capital of the United States. One thing is that we are receiving an unprecedented number of retirees. And in fact, our net migration is the highest of any state in the United States. Between 2010 and 2030, it was predicted we were going to grow by 4.8 million. We've exceeded those figures. Florida's older population is the bulk of this evolving demographic. Younger people will be in the minority. And it's important to remember that 1 out of 5 people residing in Florida were born outside of the United States. And I'll come back to this as well. Why is it that the FTC in 2019 found Florida to be one of the most vulnerable states for fraud and identity theft? Well, as I just showed you, we have the largest net migration. We have a larger number of seniors living in Florida on fixed incomes for 20 or more years. We have the second highest prevalence of Alzheimer's disease, and we are among the lowest state to provide spending on aging services. Florida is among the highest states with seniors living in poverty, and minorities are disproportionately affected. I do want to say that minorities underreport more than anybody else, and that 21% of Florida adults aged 50 and older with perceived cognitive impairment reported that it interferes with their ability to work, to volunteer, to engage in activities, which I will also come back to because there's a whole set of psychosocial factors that are contributing to financial exploitation as well. So here's the top cities in Florida that are most likely to be scammed, and in other words, it's everywhere. I come from the hotbed of scamming, which is Miami, Florida. So let's look at some of the risk factors that we know that have been documented in the literature, and each one of these are from different studies. First, the financially vulnerable. We've already talked about that, but I also want to call your attention to the second to the last one, which is people who are not financially vulnerable, but they're overconfident in investing. And we focused a lot on the elderly, and we focused on people who are disadvantaged, but there's another demographic that's getting scammed, and it's sort of a bimodal distribution. People in their 50s who are at the peak of their financial decision-making acumen, which somebody already brought up today, and those people tend to be overconfident, and they get scammed too. So this is hardly an aging phenomena. Of course, it is related to age, 50 and older. The emotional vulnerable, which I will come back to. And I want to make a distinction between, social isolation is definitely a risk factor, but loneliness is a greater risk factor. People who have that subjective perception of being alone. So social isolation, yes, but loneliness the most. Anxiety. I didn't catch your name again. Laura. Laura's story is so classic. I mean, the depth of what happened was striking to me. I didn't even know about that app, which is really amazing. But her story of being under stress is so common. And there's actually a biological phenomena that happens when you're under stress, is that you're releasing all this cortisol and you're flooding. And so your ability to evaluate a situation under stress and not under stress is really very different. And you don't have to be cognitively impaired. You can just be stressed, and that rush of chemistry that happens when you get upset and you get worried and tense and anxious and you start to flood. Sensory impairments we'll come back to, but there are 800,000 people, and this is an underestimate, living alone with cognitive impairments, and even a greater number of people are living alone with sensory impairments. In fact, sensory change is part of the aging process. Decline in hearing, 1 in 3 have a decline in hearing, I'll come back to that. Visual changes, all of these things contribute to difficulty evaluating a situation and making an informed judgment. And I might add, this is just part of the normative aging process. And finally, limited facility with English, less education. These people are particularly vulnerable. And they're also more stressed. They tend to live in communities where their neighborhood is overburdened. It isn't just a phenomenon limited to one person. This is happening in large blocks. So why does age make us more susceptible to deception? First, there's a decline in general processing skills and a component processes relevant for decision making. So our ability to monitor information and to integrate information changes over time. Increased social isolation, I already mentioned. Increased trusting behavior. As one ages, trustingness increases, and that's been well documented. Reduced sensitivity to regulate arousal cues, and I think we're going to be hearing more of that from our panelists. There's actually areas in our brain, which Dr. Sprang, Dr. Turner is going to talk about, that are changing as part of the aging process. And it doesn't have to necessarily be a deviant process. It can be changing over time that makes us more vulnerable to poor decision making. About 1/2 of individuals, by 1 in 3 over 65, have some hearing loss, and half of those over 75 have a hearing loss. And this hearing loss is one of those sensory changes where if you hear fragments or parts of communications that are being delivered, you will grab that fragment and make a poor decision based on the fragment and not on the entire message. And this is how hearing decrease puts you at risk. Again, you don't have to be, at the point where you're wearing a hearing aid. You can be at the point where it's just harder for you to hear in noise, that this phenomena can kick in. So then there's real disability, and these people are also at risk. That 1/3 of Florida residents age 65 and older have a census-defined disability, as in about 20% report an ambulatory difficulty, 13% report a serious hearing problem, that's unlike what I just mentioned. These are people that are qualify for hearing aids. And 14.2% report independent living difficulty. Now let me back up and just say, ambulatory difficulty is being studied now because while we're up here talking about the brain, we know that the brain and the body are communicating all the time, that we're talking about a problem that isn't just up here, but it's how we walk, it's how we hold ourselves, it's our balance, it's our sensory awareness. And people who are frail, physically frail, who show muscle weakness, who cannot manage to ambulate with the same degree of facility as they did when they were younger, they're at risk too. They get out of the house less, they do not initiate activities that involve getting up, driving, going from place A to B, medical care. These people who are frail are at risk for cognitive decline just by being frail. I already mentioned the hearing difficulty, and then of course independent living difficulty. As I mentioned, 800,000 people are living with cognitive impairments in the community. And these are people who are particular targets for scamming. So one thing that we haven't talked about, and we're not going to get to it, are all the caregivers that are taking care of people who are home with a dementia, a physical disability. So caregiver burden is a phenomena that has been studied with more and more interest because the incidence of Alzheimer's disease is growing, but also the health trajectories for caregivers are concerned, and people who are taking care of a loved one, the stress associated with the responsibilities, they are vulnerable to scamming as well as the person that they're taking care of. So one of our recommendations that we're going to be talking about is how are we going to approach this problem? Are we going to be training individuals to avoid scams, or how about the people that are taking care of the people who we're worried about? So at the University of Miami, we're starting to study now this big profile of susceptibility to scamming. And we're focusing on a constellation of factors. First, we're looking at cognition. We're looking at mood and emotional well-being. We're looking at affective, like psychological well-being. We're looking at their facility with computers and their efficiency. We're looking at, as I mentioned, frailty and their IADLs, which are instrumental activities of daily living, more complex things like balancing your checkbook, making appointments, following up on medical care. And then we're looking at specific questionnaires when we're working with Natalie Ebner at the University of Florida, and we're collaborating together to try and understand how people make decisions and their ability to detect scams. My colleague is Sarah Getz. We're both in the Department of Neurology. And we have developed a questionnaire called Assessment of Situational Judgment. And this is a questionnaire that measures one's ability to detect a scam. It's a novel instrument, and we based it on real-life FBI scams in Florida. It's composed of 8 actual scams and then 9 legitimate scenarios. And we're interested in whether people can differentiate between a real scam and a scenario where you might be asked to give personal information that's legitimate. So for example, you receive an email from your bank stating that your financial information has been compromised. The email contains a link for you to click on to solve the problem. Do you click this on? No. And then we explain why, how to avoid this scam. And we're starting to put in place this educational program for people to learn the rules. And it's not going to be foolproof, we know that, but at least we're going to increase awareness this way. And we say that you'll be primed to receive the information and maybe think twice what you're going to do. You're shopping at a grocery store and you're approached by someone who says they've won the lottery, that says they won the lottery but don't have an account to deposit the money. They will state they will share the money with you if you provide your bank account. People actually did this. This is a real scam in Florida. Nope. And then again, how to avoid the scam. So I want to tell you something interesting now about what we have found. These are very preliminary findings. We're still collecting data. We're all collaborating together. You'll hear from my colleagues up here. We're using this questionnaire, and we're trying to get normative data on this across a number of both genders and in different socioeconomic strata. So our participants are largely college educated. Many have a graduate level degree. They largely women. And now I want to show you something. Many live alone. Most don't. All use social media. Oh, well, 80%. Among those 69 years and younger, they're on the computer 4.8 hours a day, but 70 and older, they're on the computer 2.2 hours a day. Now this is where it really gets interesting. If you ask somebody whether they've been the victim of a scam, but only 25% say no, and we know that's an underreported statistic. But if you ask them whether their friends have been scammed, 55% say yes. So we do know that people are more likely to report whether their friend's been scammed, whether they themselves. Has anybody ever tried to take advantage of you? Almost 75% say yes. So that's how frequent this is. And do you feel that you have sufficient information about scams that you would recognize an attempt to deceive you? And 75% say, yeah, I do. 77%. Now, what's interesting to me about that is that I actually think that's true. I think people think that they know how to identify a scam. But the problem is that what you think you're going to do and what you do in the moment are very different things. So if you have a set of circumstances where you're anxious and upset and you're not going to think in the same way, you're not going to make the same judgment. If you have a situation where you're calm, you get an email, you've got some time to think about it, you're going to behave differently than an email that you get under stress and your mindset's in a different place. So what we're finding again and again that while people think they have the information, and they actually do, they can take different scams and say, yes, this is a scam, no, that's not. In the moment, we know that something happens that's different. And that's a discrepancy that we have to start thinking about, is that how is decision-making, when you're in that moment, when you have to make that judgment, how is that different from your decision-making process when it's sort of an intellectualized perspective that you can take when you have more time to think about it. Okay, so the next speaker, let me see. Yeah, it didn't.
Good.
My last slide was just was a slide from the University of Miami about scams that we need to protect ourselves.
Sorry.
I know, I don't have it. Oh, there it is. These are I just got this 2 days ago about be on the lookout for these scams. I mean, we're constantly getting emails now trying to inform the university community what to do because it's been a big problem at our institution.